Okay, all right. Good morning, everyone. Let's come now to the last session of this course. We will have a short summary and recapitulation of the sessions that we have been go through, and then at the end of this last session, we will have a short discussion to evaluate the whole course, to identify the strength and the weakness of this course from the point of view of the participants. And then last but not least, we will explain and give some information about the online examination for the participants, both participants who will take credits from this course or not to take credits from this course. Okay, let me start the recapitulation of the first 5 sessions and the 9th session, which is related to the session, the second session or the third session. The first session, we learned from the resource person about the preventive education. We learned what is HIV and AIDS stand for, and we have learned that HIV is the most serious stage of HIV infection. There are 3 main modes of HIV transmission: the blood, through the blood, such as transfusion and injection; unsafe sexual behavior, both vaginal and anal sex; and mother-to-child transmissions, such as pregnancy, childbirth, and breastfeeding. And then to conduct an effective HIV prevention, it is important to have the people or the community aware the risk and able to make safe choices and have access. For making the population aware about the risks and be able to make safe choices, knowledge is very important. Therefore, preventive education is a crucial effort to prevent HIV and AIDS epidemics. Through preventive education, we will transfer the essential practical and knowledge and attitudes and develop life skills to reduce the risk of HIV transmission. Why we need to conduct this preventive education, this course especially, as one mean of preventive education? First reason is because millions of people are still at risk of getting HIV infections. Many people still have little access to information, and there are still common misunderstanding and prejudice on HIV and AIDS. And why we focus on young people? We have several reasons for this. First, because young people engaging in the 3 key risk behaviors and their widespread ignorance about HIV/AIDS among young people. Most of young people have a lack of knowledge, skills, and attitudes towards HIV and AIDS. And adolescence is a period of experimentation and physical and emotional change. Based on these reasons, we can understand why we should focus our preventive education programs to young people. So this is the message from the first session, which is delivered by Mrs. Roseanne Wong from Bangkok. In the second session, we have learned from Professor Samsurijal about the biological aspect of HIV and AIDS itself. We learned how HIV infects to human and which cell of the body is infected by the virus and how the disease develops in human being. And in the third session, we learned from Professor Subasira the global situation of HIV and AIDS. HIV is a mutation of HIF. It happens in about 1950s in African countries first. We have learned also that human fluids as the means of transmission. For example, the blood, semen, vaginal fluid, amniotic fluid, saliva, and breast milk. Human factors influence HIV spread. For example, the high prevalence of sexually transmitted infections, inadequate knowledge of AIDS and perception of risks, multiple sexual partners, and low use of condoms. There are also some environmental factors facilitating transmission of HIV and AIDS. First, poverty and low health status, low status of women, displacement, violence, migration, stigma, and discrimination. Stigma and discrimination, today we have a deep discussion about stigma and discrimination. There are three main routes of transmissions. First, sexual contact. It can be occurred between male to female, male to male, and female to female.
Welcome to Unified Conferencing.
Blood exposure, such as injecting drug users, occupational exposure, and transmission. The third route is mother to baby, such as baby birth, breastfeeding, and also pregnancy. In the fourth session, we learned from Mr. Panduryono the situation of HIV/AIDS in Asia Pacific. Mr. Panduryono stressed two main drivers for HIV and AIDS epidemic in Asia Pacific: sharing needles among IDUs and multiple sex partners. We have learned that different behaviors of the community results in different trend of HIV/AIDS epidemic. HIV transmission in Papua, for example, is mainly related to multiple sex partners. There's also gender difference. In this case, in Papua case, male have a higher risk to get HIV/AIDS compared to female. Topography difference, highland, more HIV case compared to lowland. And also ethnic difference, the Papua have higher case compared to non-Papua. Dr. Panduryono presumed that the picture of HIV epidemic in Asia Pacific is very diverse. HIV epidemic in Indonesia and Vietnam, for example, is still grow and become more diverse, while the prevalence in Thailand, Cambodia, and Myanmar is already declining due to effectiveness of preventive efforts. Dr. Panduryono also stressed the importance of condom use as a mean of HIV/AIDS prevention. Now we come to the next session, the fifth session. We learn again from Professor Subhas Hira from the WHO. First, we learn some results of various studies. For example, the study that proved that immune suppression due to semen leaking into bloodstream, new entity labeled AIDS in MSM, and Professor Hira is raising the theory of heterosexual transmission of a causative agent. And then there is an epidemiologic study of mosquito transmission that did not show any relationship. And from the United States, there is a prospective study of MSM showed that 2-fold reduction in HIV among circumcised men. So about the key population, Professor Hira stressed that the core transmitters has very high risk to transmit or to get HIV infection, 10 times more sexually active than the non-core group. They are also selecting partners, in this case sexual partners, randomly. Intervention to reduce STI is found as very important to control HIV and AIDS epidemic. Knowing HIV status will reduce risk-taking sex behavior. Also, fewer STI, sexually transmitted infections, and better coping skill will also help to reduce HIV and AIDS. Antiretroviral therapy is very important because ART improved survival, will result in better quality of life, reduce sexual transmission rate, and also the cost is actually not that high. Migrant population should receive special attention. For example, those who experience disaster, by environmental or natural disaster, political unrest and also financial problems of the population or community. Now let me jump to the session 9, because the session 9 discuss about the biological prevention, which is related to the session prevention about the key population. Preventive, in this session, Professor Samsul Rizal presented that prevention should cover 3 preventions: structural prevention, behavioral, and biological prevention. Biological prevention includes, among others, circumcision, condom use, and ARV treatment. Transmission of HIV positively correlates with viral load. Therefore, treatment with ART for people living with AIDS is crucial to prevent HIV transmission. I think this is my part to deliver the recapitulation of session 1 to 5 and session 9. So let me deliver the time to Dr. Ishar to continue recapitulation of the other session.
Okay. Can I have my slide, please? Synthesis. Ada, sudah ada di bawah itu. Okay, thank you. This is indeed a very short synthesis. Can I have the first slide, please? Okay, with regard to country situations, all the countries still in the low concentrated epidemic with typically prevalence level of 5 to 9% at the in the female sexual workers, and between 10 to 20% prevalence in IDU groups. Also prevalence
Welcome to
about
Unified
5%
Conferencing.
in MSM, client of sex workers and transgenders. The main key driver of the infections in the countries, in the 4 countries, is IDU. Actually, it is the interactions between the IDU groups and the female sex work groups. IDU sell and buy sex, and some of the female sex workers also injecting drugs. The country also experienced an increasing number of reported cases in the last 3 years, and most of the affected people are young people aged between 17 and 25. In all countries, the proportions of male HIV positive is bigger than female, with the proportions of 80% of male and 20% of female. Okay, on the next slide, please. On the country response, the national plan exists at least in 3 countries. In Indonesia, we have national strategic plan and action plans for 2007-2010. In Malaysia, they have strategic plan for 2006 and 2010. And the Philippines, they have operational plan for 2009-2010. The program of the countries focus on preventions and prevention on the most access groups, and combined with the care, support, and treatment. Most countries has piloting on PMTCT. With Malaysia have mandatory testings for pregnant women as part of the antenatal care. All countries do surveillance. The second generation surveillance, we call IBBS, the integrated biological and behavioral surveillance. Most countries do active screening for donor blood. Malaysia, I think part of that also do premarital mandatory testing, as we just learn from today's sessions. And most countries now also focus on VCT, both the voluntary and provider-initiated VCT. We call it opt-in and opt-out. Okay, that is the synthesis from the country situations and response. Now let's move to the synthesis from the religious perspectives. This is only have one slide on this. I think this is a 3-point from the presentations. All religious believe respect human being regardless of their HIV status, and we should provide help in terms of treatment, shelter, etc. for those in need, and we should not stigmatize and discriminate people living with HIV/AIDS. Thank you.
Okay, the last part is the psychosocial and economic impact on HIV/AIDS and its political issues. So the psychological impact was delivered by Prof. Irwanto, and he said that it is about how one thinks, feels, and reacts to being infected with HIV/AIDS or to the loved one. And then usually they feel like death, dying, impoverished, discrimination, and stigmatization, harassment, and abandonment are common to the people living with HIV. And then in children, usually it's associated with the loss of parental care, and they will be ashamed, depressions, and trauma. After testing, usually people will disbelieve about what's the result of the test. Shocks followed by numbness, crying, anger, and frustrations. And after a while, some of them blaming others and revenge. And some of them are just doing the same things, so they don't want to think about their HIV status, including doing their risk behavior again. The social impact of HIV/AIDS is it means that the consequence of HIV/AIDS in the community. So usually they lost their basic rights, such that we already discussed today, and the right for health, education, work, and travel. And in the community,